Hello, and welcome to the PAHO podcast, Turning the Tide, NCDs, Mental Health, and the Urgency of the United Nations High-Level Meeting. This is a space where we have a conversation with experts on NCDs and mental health and unpack these most pressing health challenges. I'm your host, Silvana Luciani from the PAHO NCD program, and I'm really excited to bring to you all that we're doing at PAHO with governments, civil society, academia, and the public to prevent NCDs and promote mental health and improve the health system response for better care for NCDs and mental health. Today, we're discussing the fourth high-level meeting of the United Nations General Assembly on NCD Prevention, Control, and Mental Health Promotion. And in this episode, we're focusing specifically on tobacco, perhaps the most important risk factor for NCDs. And joining us in today's session is Rosa Sandoval, the Regional Advisor at PAHO for Tobacco Control and Economics of NCDs. Welcome, Rosa, and thank you for being here with us.
Hi, hello, Silvana. Thank you for having me.
So, Rosa, let's start with the basics about tobacco control. We know that tobacco use is decreasing. That's the good news after many years of promoting regulations and policies to reduce tobacco control. But what can you tell our listeners about the tobacco situation in the Americas region and what can be done to reduce tobacco consumption?
Yes, indeed, good news, right? The trends of tobacco prevalence in the world and in our region in particular are decreasing. And this is thanks to very cost-effective interventions that many of our member states have implemented in our region. But I want to start by touching on the concept of commercial determinants of health. When we talk about tobacco control or when we talk about how to reduce alcohol control or promoting healthy diets, we tend to think that personal choice is at the basis of this. And while personal choice is important and is a factor, these decisions, these choices of what you consume, what you buy, tobacco, alcohol, ultra-processed food, do not happen in a vacuum. We're talking about industries that through different ways and strategies are trying to get consumers to, for example, start in the consumption of tobacco, which is a highly addictive product. So what we see in the region, and back to your question, Silvana, what worries us is that we still see many of our member states with what I would say a high prevalence of tobacco among youth. And when we say youth, I'm talking about 13 and 15-year-old kids. So number one, it's that we still have, in many of our countries, there is still not acceptable prevalence of tobacco use among kids. We need to protect our youth from exposure to tobacco in general. Number two, what we see is that when we compare consumption among 13 and 15 years old between men and women, we see that they consume approximately the same tobacco products, and I'm going to get into electronic cigarettes as well. Well, when we see the data for adults, we see that men consume more tobacco than women. But when we see among the kids 13 to 15, we see them consuming this in the same amount, or the prevalence, the percentages are similar. What this is telling us is this is like a window to the future, because we're seeing that in the future, that disparity among men consuming more than women is not going to happen because our young population is consuming the same. This is what we call in PAHO the feminization of the tobacco epidemic. And this is what worries us. What do we need to do? We need to implement cost-effective interventions as, for example, banning advertising, promotion, sponsorship of tobacco products, which is another way of calling this intervention is protection of our youth from misinformation. The advertising of tobacco is by definition misinformation, because there's no way to advertise these products in a way that is truthful to what these products cause in terms of disease and death. So yeah, good news, but we still need to work a lot with youth and in terms of protecting them and that they don't start in the consumption of this highly addictive product, and also protect them from these novel products as electronic cigarettes.
Thank you. Thank you, Rosa. And you're so right that tobacco is not just about individual choice or behavior, that we're really all influenced by the environment, the advertising, the social norms, and that youth tobacco is increasing, especially among girls, and that it is problemsome. and that we must focus a lot on the regulations that will limit advertising, promotion, and sponsorship and create smoke-free environments to help prevent tobacco use. Thank you, Rosa. So let's turn now to the UN high-level meeting on NCDs and tobacco. We know that this September, all the heads of governments across the world will come together, and it will no doubt lead to a new resolution calling for bolder actions on NCD prevention, including for tobacco control. So, what can we expect for the tobacco agenda as a result of the high level meeting?
So one of the things that is particular to tobacco and to other risk factors of NCDs is that in order to implement effective interventions, we need intersectoral dialogue. For example, the most cost-effective intervention by itself is increasing taxes on tobacco products. And the results of not using this intervention, we are going to see them in the health field. But the competence to implement this policy is with the Ministry of Finance. So we need that intersectoral dialogue as to use tobacco taxes as a tool to not only increase revenues, which of course is something that interests ministries of finance, but also to reduce consumption of tobacco products. As we know, Silvana, tobacco is the common risk factors to the main 4 non-communicable diseases in the world. So what we do about tobacco control is going to really change the future of non-communicable diseases. So what we expect is that these fora of heads of states will be an opportunity for different sectors to put together their interests, their goals, their visions, and see the benefits of interventions that sometimes do not rely within the hands of health authorities, but that do impact the results of the health and the well-being of their population. I mentioned tobacco taxes, but also if we talk about, for example, warnings in tobacco packages, and we need to discuss this, for example, with ministries of industries or trade, and of course our colleagues in ministries of trade will ask us, how does this fit with our agreements within WTO? And these are very genuine questions that we really welcome from our colleagues, as I said, for example, from the Ministry of Trade or the Ministry of Industry or the Ministry of Economy. And we are lucky that we have had 20 years of experience in implementing these interventions in tobacco control. So now we know that these health policies, health interventions do not conflict with trade goals or economy goals or finance goals. So we do hope that there is more time and that there is enough time to discuss these policies and to get our heads together on a common vision to increase the well-being of our populations.
Thank you. Thank you, Rosa. And indeed, the benefit of having a UN high-level meeting on NCDs is just that, to promote intersectorial collaboration. So not just health sector, but also finance, economy, agriculture, all parts of the government and indeed all parts of society to work together on tobacco control. And we do hope that the resolution will call for stronger regulations and especially for increases in tobacco taxation, which can help reduce tobacco consumption. Thank you, Rosa. And so PAHO, has been leading tobacco control efforts in the Americas for many years, over 20 years. And we've seen a lot of successes, especially in smoke-free environments, plain packaging, among other interventions. So how do you think this new and renewed political commitment around NCDs can help support PAHO's work in tobacco control in the region?
Yeah, I think bringing light to our successes and learning from them. You mentioned smoke-free environments, for example, and yes, of the 35 member states in the Americas, 24 have implemented smoke-free environments. This means that they have passed a law that says that it's not allowed, that it's banned to smoke in public places and workplaces. This means that, for example, what you are doing is you are protecting workers and offering them a healthy work environment. So I would hope that with meetings like this, the other countries that have not yet implemented smoke-free environments, 11 countries in our region, will see that it has been possible to achieve consensus on this policy. Sometimes even us in public health think that approving a law like smoke-free environments or introducing mandatory warnings in packages or banning advertising subsidizing promotion, sponsorship, or increasing taxes. Sometimes we think that this is very difficult, that it's almost impossible. And it is true that it's not all these successes have not been achieved from one day to the next, but they have been achieved. So it's been possible to achieve consensus at country level among different congresses. 24 different congresses in our region have approved a measure like this. And we're lucky to see that this has been an effort to prioritize health regardless of our different political views, for example. So political consensus, legal viability, economic viability of these policies have been proven in different social and economic settings in our region. Different countries of our region have already done it. So as I always say, we're very lucky to already have that wealth of experience. And I hope that this dialogue that's going to happen in September will bring light to what we've learned and encourage other member states to make the same progress.
Thank you, Rosa. And indeed, successful experiences are easy to replicate once you promote them and just advance on implementing new regulations and new laws. So we are all hoping that the new resolution and political commitments will spur new policies for tobacco control. Thank you, Rosa, for sharing your insights and your passion for tobacco control with us today. And to our listeners, thank you for joining us in our podcast today. I really hope that we've brought you new information and inspired you to make changes in tobacco control in your countries. And if today's episode resonated with you, please share it in your network. And please also visit the PAHO Tobacco webpage for resources, data, policy briefs on tobacco and other NCDs. Together, we can really turn the tide on NCDs and mental health and protect the well-being of future generations. So until next time, stay informed, stay engaged, and stay healthy.